Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is an overview of medial branch blocks. Back pain affects 90% of individuals at some point in time. Back pain is the second most common reason people see a doctor, just behind the common cold. It's the leading cause of disability in those under the age of 45. Up to 40% of those who undergo back surgery are unsuccessful. The cost of back and neck pain exceeds $100 billion every year. In the back, when you have back pain, the intervertebral disc is the source of that back pain about 40% of the time. The facet joints, on the other hand, are the source of back pain 45% of the time. Now, these are thumbnail-sized joints on either side of the back of the spine at every level, all the way from the neck down to the sacrum. Okay? They do have cartilage, and they are prone to arthritis, just like the hip or the knee joint. They may be small, but they can cause a tremendous amount of back or neck pain. So when looking at diagnosing the source of the pain, it's a combination of things: the history, the physical exam, imaging studies, x-rays, CAT scan, MRI. Here is shown a CAT scan where you have facet joints back here and here, which look great. There's really minimization of any joint loss, no bone spurs, or these basically look perfect. Unlike this view, where you have minimal joint space left, there's a lot of bony overgrowth and kind of rattiness. So that's what facet arthritis looks like on a CAT scan. So the medial branches are the little nerve endings that supply sensation to the facet joints. Okay, you can see a nerve root coming out here from the spine. That's not what we're talking about. We're talking about the little nerve endings that come off of the nerve root. Now, each medial branch has nerve endings that go up to the joint and then down to the joint below. Okay, so there's a sort of a dual sensory innervation to these facet joints. These don't have any motor function whatsoever. It's all just sensory. A medial branch block is performed for two reasons. One is diagnostic, to see if in fact that joint is the source of the pain, and the other is therapeutic. It can provide pain relief for months. Most modern pain doctors do use some sort of image guidance, whether it's ultrasound or fluoroscopy. Numbing medicine is injected around these nerve endings, possibly some steroid. It's an outpatient procedure. There's no sedation needed. It takes about 10-20 minutes to do the procedure. So diagnostic, as I mentioned, it helps pain doctors figure out if the joint is the source of the pain. If the injections work well and then wear off, a radiofrequency ablation can be performed to provide long-term pain relief. Now, therapeutic studies have shown that the average pain relief is over 3 months, so it's very good at longer-term pain relief. The procedure works well in 85% of patients, and repeat procedures can work just as well. So you can either repeat the medial branch block or go on to a radiofrequency procedure. The radiofrequency procedure basically has a catheter going into the same area where the needle goes, and it just heats up with thermal energy and deadens those little nerve endings for up to 2 years. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 different treatment options with the board-certified physicians. For the top pain management in Austin, visit us online at painmanagementaustintx.com, and then call us for more information and scheduling at 512-456-8886. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.